Hi, my name is Thủy. I'm one of the counselor working as a counselor, traditional Chinese medicine, also aromatherapy. I've been trained in Australia with the full level qualification for Chinese medicine to be practiced here. Working at START is a great privilege for me. I think being a counselor slash like doing TCM combined in terms of treatment for torture and trauma patient in Australia and Sydney in the context of START is quite important. In every muscle, we have a memory and a signature of the memory of the pain. So in terms of to relieve the pain, you must able to reach to polyvagal nerve as a simple way of saying in a Western context. But in Chinese context, we have looking at the sinew middle channel and then the deeper divergent channel. So on that many level will provide a process of connection to communicate with the brain and to relieve this signature of pain. So acupuncture can really open and shut like release endorphin so that the client feel less pain. Seeing so many clients have gone through a chronic pain and having a lot of difficulty in terms of express their emotion and talking about their trauma. And the first thing that they bring up is all about pain. And significantly, they feel pain, they feel hurt, they feel injustice, but then it comes along with the pain. We know that that acupuncture is not something new in terms of the treatment. Has been a thousands of years. Many have come to this the clinic and they have give a lot of feedback, and they have been diagnosed, and many of diagnosis they don't know where to sort of turn, reducing their pain symptom, whether it's somatic pain or physical pain. They've been through so much long-term imprisonment, torture, and trauma. Having TCM to bring them back slowly and start with the core a perpetual avoidance model that people tend to avoiding significantly, that the sensory of this pain has become so severe that their psychological have been blocked. Then they're not ready yet to talk about their trauma. And while they bring up that trauma, the pain just refuse to let them respond to the thing, not because they don't want to, but finding that they come here and they found a lot of relief. And it would make much better in terms of working with the client, that they work collaboration with the counseling. We have to use a combined model of treatment, whether we use psychotherapy, neurofeedback, combined acupuncture, even community development team. We work together and have a good sense of therapy, because acupuncture is not just a providing needle, but to provide embodied healing. The years that I work, I often would invite the counselor into the session together and see the level of the work that is provided. So that provide a counselor a connection and a communication. In Chinese medicine, we use a lot of other form of acupressure, Chinese medicine is diverse. In terms of when they hear acupuncture, they might think of just using a needle. Of course, some patients, like young children, you don't use needle. If someone who is having a highly fear of needle, or they have been in the past who has been tortured by needle, of course, you would not want to use needle. Laughter as medicine, aromatherapy were used as medicine. We use ear candling techniques to ease down the anxiety level in terms of the pressure of the brain. We can use other techniques. So TCM, Chinese medicine, have been profoundly diverse as a holistic way. So if it's just acupuncture is just one of the small window, and how you provide these acupuncture techniques is very important. Oh, I'm happy to be people inquiry, always inquiry, and always have a question. I think it's important that we work in this field. We need to be transparent of who we are, what you can do, what I can do, providing the client. What I can't do must be addressed, because we cannot treat every disease, address everything.